You're for your heart is really good for your brain too.
I'm so excited about that. So we have that to look forward to in January of 2018, and we'll definitely do another video about that. And we're live, I believe. So I'm excited to get started for Tuesday Tips today. For those of you who are joining me, I've got a guest you might see. His name is Dr. Steven Masley, and he is one of the featured physicians in our Advanced Nutrition for Health Coaches training. And he is teaching us in that training about heart health. He's our heart health expert. And if you haven't met Dr. Masley before, first of all, I'll tell you, you're in for a treat because he's an absolutely delightful person. I had the opportunity to have dinner with him and discuss all things France before I went to Paris. He gave me all kinds of wonderful tips about going to France. But mostly I was so impressed with Dr. Masley's background, his expertise. Let me just tell you a little bit about him, and then he's going to go into some detail about how he sees health coaches working with doctors, and then more importantly, we're going to go into some detail about some of the steps he recommends for heart health. So Dr. Masley, if you don't know him, is a physician. He is a nutritionist. He is an author, a speaker, an award-winning patient educator, and he's really devoted his medical career to the study of heart disease and aging. He's published significant research on these subjects in leading medical journals, and his passion is empowering people to achieve optimal health through comprehensive medical assessments and lifestyle changes. And you're going to feel that passion. It kind of comes out of every pore of him. And he's received the award of fellow from 3 prestigious organizations. First is the American Heart Association. Second is the American College of Nutrition. And third is the American Academy of Family Physicians. And he's also a clinical assistant professor at the University of South Florida. He teaches programs at Eckerd College, and he sees patients from across North America at the Masley Optimal Health Center in St. Petersburg, Florida. What a beautiful place. And on top of all that, in his free time, he's published several health books, including Smart Fat, The 30-Day Heart Tune-Up, 10 Years Younger, and your book that's coming in January of 2018 is called again?
The Better Brain Solution.
The Better Brain Solution. He's also published numerous scientific articles. He's been featured on the Discovery Channel, the Today Show, PBS, and over 250 media interviews. And to top it off, if that wasn't enough, he completed a chef internship at the Four Seasons restaurant in Seattle, and he's performed cooking demonstrations at Canyon Ranch, at Pritikin Longevity Center, on multiple television appearances. We are so, so honored to have you here talking with us and sharing with our students. Thank you for being here, Dr. Masley.
Well, I love talking with you, so I'm really looking forward to this today.
Oh, I'm going to blush. I love talking with you too. You're one of my faves. So let's hop in and let's talk about what you think. You know, you have such a breadth of experience and knowledge, and a lot of us as health coaches are just coming into the field of health coaching, so we don't have the same perspective that you have. Mm-hmm. So in your opinion, what is the importance of coaches in the healthcare industry?
Well, I think we probably give a little too much value to doctors and think they can do these wonderful things, but really it's mostly up to us. That if we focus on healthy food, eating our key nutrients, getting fit, and manage of our stress, if we do those 4 things, most of our health problems go away and we hardly need our doctor. So, and I feel really blessed. I see 1 or 2 patients per day, and I have 2.5, 3.5 hours per patient. But let's be realistic. 99% of doctors are seeing 30, 40 or more patients per day. They don't have time to focus on food, nutrients, fitness, and stress management. They might encourage it, but they don't have time to give you the details, the tools. People need to be taken by the hand and given this information. And health coaches are the perfect people to do that. That they can do, really 90% of the benefits we could get could be done by a coach. And if everyone had a coach who could help them do the right foods and the right nutrients and get fit and manage stress, if we did those things, we wouldn't need most doctors today. So we need more coaches, and we need them to be more interactive and acting with patients to really take them by the hand and give not just the right information, but the tools and the how to make these changes.
Yeah, and to be there for someone when they get confused or stuck or lost or overwhelmed or unsure, or they feel like, I just can't do it anymore. I have to eat sugar. I'm going crazy. That's what a health coach is really good at. So what's interesting is you're really talking about health coaches being vital for preventative healthcare. And it seems to me that preventative healthcare is becoming more important because it's almost unavoidable now. Like financially, we can only sustain, I mean, how much sickness can we sustain as a country financially?
Yeah.
I don't know.
And we can prevent 90% of heart disease. You know, yes, we can do all these procedures that are invasive and have risks, but if we just did the prevention things, 90% of it would go away. And for memory loss, we can't treat it. We can only prevent it. So if you wait till you have symptoms, your brain's already shrunk and it's too late. We've got to prevent it. We're facing an epidemic of memory loss. Heart disease is still the #1 killer for men or women. I mean, we need to prevent it. Thank you for saying that.
Well, I'm shocked, to be honest, that 90% of heart conditions or diseases or challenges can be prevented. I mean, 90%, that's a massive number.
Yeah.
And I think it's helpful for health coaches to hear. It's helpful for me to hear because we often think that the simple changes, habit changes, like helping your client drink water, I mean, seems so basic to a health coach. Like, how could this possibly be useful? But actually, it's incredibly useful because it's really hard for some people to drink water. I mean, it's hard for people to do the basic stuff. Even there are things I should be doing. I know I should be doing, and I don't do them.
And they get
confused.
Yeah, you made the good point. People get confused and they're unsure what to do. And just to hear that repeated voice over and over, eat these healthy foods, meet these key nutrient needs, get out and take a walk, do the right things. It just has a tremendous impact.
Yeah, and also to remind, like, hey, you're doing a good job. You've done this, you've done that, you've done this. You're doing great. Like, to have a little bit of a cheerleader is really nice too.
Well, it's encouraging. You're more likely to keep going if someone gives you positive feedback. Yeah, absolutely.
Yeah, keeps motivation in place. So in Advanced Nutrition for Health Coaches, you have an awesome protocol for heart health, and I'd love to just dive into one or two of the things that you share there. And one of the key pieces, and it's one of your the 4 pillars that you teach, and that is stress management. And I wanted to just talk for a second about stress management and why it's so important for heart health.
Well, if we're stressed out and we're not managing it, a lot of people are stressed out. Let's face it, the world is not getting more peaceful. And you read about it in the paper every day. And whether it's in your family or at work, it's on the news. It is stressful. And we have to proactively take steps to manage it. And if you don't, your cortisol goes up, your blood sugar goes up, you grow more plaque. I mean, like the day they had that big earthquake back in Los Angeles, that day, heart attack risk went up 500%. So when we're stressed out and we don't manage it, it has a huge impact. So we should do something, take steps to help lower our cortisol levels, manage our stress every day. If you do it proactively, it's so much more effective. And I think this is something health coaches could be really instrumental at in helping people proactively take steps, take the time to do that.
Yeah, and I love one of the tips you recommend because it's doable, and that is beginning or ending your day with just 10 minutes of some peace and some calm, and like setting a timer and letting yourself completely just relax for just 10 minutes.
Mm-hmm. Could be
Simple
a bathtub, watching the sunset, something, meditation. There's all these tools and devices now we can use. HeartMath, something that gives you biofeedback. I love HeartMath. All these 10 minutes a day really does make a big difference in lowering and changing hormonal status, improving many aspects of health, and it's super good for your heart and your brain.
I agree with you, in trying to recover from having a baby, which has been way more difficult than I ever anticipated. I found that meditation has been a huge piece of it. And that 10 minutes of calm may be the only 10 minutes of the day that's calm. And it helps me like just survive, really.
Yeah. I think a lot of people don't ever get 10 minutes of calm. They don't know what it's like to be, they drag their head off the pillow until it collapses. And there's not 10 minutes of downtime all day. So it's amazing how effective that can be.
Great. So that's a wonderful tip that everyone who's watching can take away, or you can help your own clients with to help them get some of that calm, some of that downtime, even 10 minutes a day. And let's go to another piece of your protocol for health coaches around heart health, and that's about fiber. And I think there can be some confusion about fiber. And I know you say not all fiber is created equal. So I'm curious if you would share with us what you mean by that and what we're looking to consume for ourselves and to help our clients with.
Well, thanks to the food industry and all their marketing and TV commercials, when people think of fiber, unfortunately, they think of like breakfast cereal or bread, whole grain bread. But when we take a grain and we grind it into flour, it causes a sugar jump. And that's like one of the worst things you could do for your heart. So when I talk about fiber, I want low sugar, low glycemic load sources like vegetables, fruit, beans, and nuts. And if you had more vegetable, fruit, beans, and nuts, I wish we could just have like a mantra that they would say, okay, you need to eat 10 servings of vegetable, fruit, beans, and nuts every day. That'd be like the single most powerful thing you could do for your health, your waistline, your blood pressure, your heart. So it's really easy to say, but we're not trying to get people to get their fiber from cereal and bread and pasta and all these things that have a high sugar load. So we want to avoid fiber and add more vegetable, fruit, beans, and nuts.
Yeah, and some of the actual... What?
See how easy that is to say.
It is easy to say. We need to come up with some kind of funny acronym, like, when you're learning piano as a kid, it's like GBF, whatever. They need one for fruits, beans, and nuts. But you give some amounts that are pretty easy. 3 cups of vegetables, 2 pieces of fruit, 2 handfuls of nuts and seeds, and a 1/4 cup of cooked beans. Because when I think of 10 servings, I sort of feel like, whoa, is that like a ton of fruits of it? It's really not.
Yeah, so you said it perfectly. It sounds like a ton, but it's not. So yeah, 3, and if anything we eat, all of us should be getting 3 cups of vegetables a day, whether it's kale or broccoli or green beans or, carrots or beets. Those are so important to eat. And the fruit, could be an apple, could be an orange. My favorite would be berries because they have a lower glycemic sugar load and they have more nutrients. Or cherries. I love using frozen cherries like in a smoothie. That's my favorite. And nuts, almonds, pecans, walnuts, pistachios, hazelnuts, macadamians, any of those. If you like the sound of any of those, then you want to eat them more often. And beans, anywhere from a 1/4 cup to a 1/2 cup a day, like hummus, or sprinkle them on a salad, or have them like lentil soup. But it's easy to get that amount. And that's probably if you only did one thing, that would be the most powerful thing you could do to improve your health, improve your waistline, not need medications. And so how could we teach more people to do that? And who's better?
That's incredible. Well, I agree. And I think to myself, I'm so delighted. And many of you who are listening are probably like, I'm eating that much. I did have 3 cups of vegetables today. I did have 2 pieces of fruit. It's like, yay, I'm doing a good job. And we can, of course, help our clients do the same. Because that's especially, what we teach at Become a Health Coach is eating more of the good stuff. And then the bad stuff kind of naturally falls away.
Right.
Because you feel more satisfied, you feel better, you don't necessarily crave junk in that case. Well, so when you're adding in,
and it's
you're adding in 3 cups.
Tell people what to add. When you say eat more of this, that's an easy step to take. When you say you can't have this, that's a hard sell. But when you say eat more blueberries or cherries or broccoli and they like them, see, that's so simple.
Add more and let the rest fall away. I remember, Dr. Masley, I had a health coaching client who came to me. And when we first met, this client said, I'm going to work with you, but whatever you do, don't you dare tell me to not drink coffee. And I was like, okay, so you drink coffee, that's fine. And by session 5, we had added in all kinds of good foods. And she was like, just casual, like she was saying, pass the salt. She was like, oh, I quit drinking coffee. I just quit. I was like, what? You quit drinking coffee? Because she just was adding in like actual food. She didn't need the same kind of chemical kick that she needed before. It was nice. Okay, so let's go into another tip here. In the heart health protocol, you talk about the importance of tracking your movement. And let's talk about that, because I know there were times in my life where I way over exercised, like massive, like, I don't know that you have this in Florida, but like a Barry's boot camp or a shred or like super hardcore for an hour where it was like so high intensity, right? And I used to do that and think that it had to be that 6 days a week or I was failing. And that's not what it is for movement, right? I mean, it's just about moving.
Well, the first step is just to get walking. And, people need a minimum of 10,000 steps a day. And I think the average person's only getting 2,500. So 25% of what they. So usually you can get 2,500 steps wandering around the house, doing this, doing that, making dinner, going to the mailbox. You'll get 1/4 of the way there, and it's really not enough. So there's a huge benefit to getting those steps in. And I think if you measure it and get a pedometer, they're really inexpensive. I mean, we're talking less than $10. And then plus, you can get them on a fit, the nicer devices, Fitbits and all these other gadgets also tell you your steps. So, and then you can share it with like your sister or someone, you can actually get into these little competitions with who got the most steps today. I mean, it can actually be fun if you share it with some users. So I think they're really useful. So first, get the steps in, but you get more benefit if you rev it up and you start getting a little sweaty, put on some music and dance, do something, get moving at a higher pace. As you move it up, you get incremental more benefit. But the biggest benefit comes from going from 2,500 steps to 10,000 steps a day. That's huge for your heart, your brain, your waistline, your bones. Everything gets better when you add more activity.
Yeah, I don't know that I get 10,000 steps a day, to be honest. I think I'm probably at the 2,500 because it's a lot of, I'm running after my kid when I'm with her, but at work, it's a lot of sitting. So, something that might be fun for health coaches, if you're on Facebook, to do a check-in with your Facebook following every day. How many steps did you get? Maybe you do a little video of you looking at your steps, and you can ask all of your followers to check in with their steps and do a sort of a fun challenge around getting those 10,000 steps so that you're getting healthy as the coach and you're engaging your audience as well. So I think it's great for health, and also a little marketing tip for health coaches.
If you have a baby, putting the baby in the stroller or in a backpack and getting outside. That's just such a great example for a baby to get used to. We go for a walk every day and you just grow up that's normal. See, that's a huge benefit. It's not like you have to go to the gym and abandon your child. No, put them in the stroller or throw them in a backpack and take them with you and let them learn from day one that movement is really important. And it's just a normal part of life.
Yeah, this is what we do. I love that. And we're doing it tonight. Okay, so another thing that you integrate into the Advanced Nutrition for Health Coaches Heart Health protocol is self-care. And I would imagine that, do people that you work with, do your patients come in thinking self-care? What is that? Are they distrustful of the phrase self-care?
I think if I just say self-care, they're not going to know what I mean. They're going to need more. They're going to need a little more hint than that, what we're talking about.
Got it. So instead of just saying to your patients, okay, well, you focus on diet only, you're asking them to look at a more sort of macro lifestyle, how they're taking care of themselves.
Yeah, every interaction, almost any time I interact with a patient, I'm going to address, are they getting their foods? Are they getting their nutrients? Are they getting their activity, and are they managing their stress? And I'm going to try to hit those 4 pillars every time I touch them. It may not be the whole context, the whole deal, but at least some part of each of those pillars gets touched with every interaction I have. And to them, they just learn to expect it. They know I'm going to ask about their activity, or at least encourage them, or bring it up. They'd be shocked if I didn't. I mean, so yeah, the self-care to me is really focused on all aspects. It's a balanced approach to health. It's not just one single thing and one interaction. You can be more detailed and focused on a topic, but at least come back and hit the whole profile.
Yeah, do you find that your patients end up enjoying taking care of themselves in ways that they didn't expect?
Well, the results are so good. Almost everyone I see, they have more energy. They sleep better. Their sex lives get better. I'm trying to wean them off their medications. The patients I saw today were cutting out meds. They feel better. They're losing weight. Their energy's better. They sleep. All those things get better. That's huge. So I like to remind them, the better you take care of yourself, the more of this care you do for yourself. Look, you're younger, you're trimmer, you're fitter, you're mentally sharper. And I like hailing their improvements. I think that's really important to cheerlead a little bit and go rah, rah, rah to encourage them to stick with it. And I think, health coaches they're really good at that. Doctors aren't. We're usually, as a profession, we're more focused maybe on their labs or their meds. I think the health coaches should and often are better at, giving that rah, rah work, because it really does help people take better care of themselves.
I also think too, it helps people remember how far they've come. That when people are feeling better and they're getting healthier, they're losing weight and their sex life is better and they're getting all these incredible results, it can sometimes be hard to remember how bad it was. So with you as a health coach or you as a doctor pointing out, look at what an incredible job you've done and look how far you've come. People go, oh yeah, I mean, this is something to be proud of and something to be excited about. And
much more likely they'll stick with it when they hear that instead of give up.
I agree with you. Yeah, I agree.
Some people's their expectations are, they're 55 years old and they're trying to get back to their 16-year-old weight. Well, that may never happen, and it might not even be important from a health perspective. It's about celebrating the improvements you've made. And sometimes if you picked an unrealistic goal, it's just trying to herald and celebrate the things they have accomplished and get them to feel good about that. And it's not, as long as they feel fantastic and they're in really good health, they don't have to, some of these things are just arbitrary. And it's trying to help them make common sense, look what you've done, look what you've accomplished, and focusing in that moment for them. I think that really helps.
That's a really good point of being able to sort of suss out when a patient or a client might have an unrealistic goal. And that whole idea of, I'm about to turn 43 and I think, wouldn't it be great if I looked like when I was 22? Well, that was 20 years ago. It's not happening,
Three babies later. Yeah. I mean,
right.
And it's not necessarily even healthy to try to get back to that.
Oh, that's
what
interesting.
You have to do to get there might actually be harmful. So let's just focus on healthy acts that make you feel better. If you feel fantastic, then I'm usually really happy. Well,
and at the end of the day, that is what it's all about. Because if you're waking up, even if you fit a certain mold physically, but you wake up and you're miserable or you don't feel good or you're exhausted, what's the point of that? Mm-hmm. As my days of when I was doing Barry's boot camp 6 days a week, I was losing my hair. I couldn't I was pounding caffeine to get through the day. I mean,
and you were in pain.
And I was in pain, and I probably messed myself up. My stress response was crazy from that. But in any case, I think that the tips that you've shared have been fantastic. And, one final thing I'd be curious to ask you about, there are a good amount of health coaches that would love to work with doctors. I think they're somewhat intimidated because there's still, even though we at HCI are trying to fight this and remind health coaches that our job is to help people change their habits. It's not to prescribe or diagnose or anything like that. That's what a doctor does, which is why we think doctors and health coaches are such a good match. Do you have any recommendations for a health coach who might be looking to work with the doctor or join a practice or like work in an office with the doctor?
Well, it's really needed. So I think here's the key points, and I think you said some of them really well. A health coach isn't trying to get in between medications and all these things and contradict anything the doctor's doing. They're there to support with the 4 changes that are going to have the biggest difference. I want to help your patient. Here's what I would say if I was a health coach talking to a doctor. I want to help your patients eat better food and make better choices, make good ones, cut out the junk, meet their key nutrient needs, like maybe vitamin D. I want to help them get fit in a realistic way, starting to get into their 10,000 steps a day, and to do some things to help manage the stress in their life. That's the focus I want for talking to the doctor for your patients. Why don't if you hire me, I'll work to make that. You don't have the time, is the truth, what a health coach can say to the doctor. You probably would love to do this, but it's not going to happen. And you're going to get so much better results if I could step in and help you. And I think that's a growing trend. There's this pitch that doctors need a team. They've got themselves, their nurses, and there's a pitch nationwide now to use health coaches. So to say, hey, I'm a certified health coach. I'd like to be part of your team and pass on your healthy message. I think that would be very powerful, and a doctor would be pretty foolish to turn that opportunity down. So to say, I want to be part of your health team, to participate and share the messages that you want to give and get patients to do the steps that you want. Focusing on food, nutrient, fitness, and stress management. I think that would be music to the average physician's ears who are interested. And if they're not interested, you don't want to work for them. So you're looking.
Move on to the next one.
Next. You're looking for those physicians who wish they had the time and they don't and are really interested in this. That's the doctor you want to work with.
I think that's great. And I would also say being willing to talk to multiple doctors, because not every doctor is going to be interested. I mean, but some are. There are, and it's music to my ears to hear you say that there's a nationwide push to have a health coach on the team. And I know health coaches love working in collaboration. They love working in team. And especially if there's anything tricky going on with a patient, it's great to know that the doctor is there, the nurse is there, and that it's a group effort to help that patient.
I think physicians are looking for someone who's certified, and that's important to them.
Yeah, for sure. Well, I'm glad to hear that as well. So a final thing as we're completing is just to say thank you so much, and to remind everybody who is watching that you have a new book coming out in January of 2018. We'll have another conversation about that. And the title of the book again is? The
Better Brain Solution. How to improve your cognitive performance by 25%. Be 25% mentally sharper and quicker and prevent memory loss.
I'm so excited to have that conversation, because after having a baby, I have found that baby brain is real. I need 25% cognitive improvement. So I'm thrilled to be talking to you again about that book. And
we all do. Basically, if you've got a brain, you need this book.
Perfect. And of course, you can check out Dr. Masley's work in our Advanced Nutrition for Health Coaches course in his Heart Health Protocol. Dr. Masley, it's a pleasure as always to be with you. And thanks for teaching me and teaching our students.
And thank you.
It's my pleasure.